One of the most common questions I hear from parents and adults is, why does it still feel so hard even when we know better? The answer isn't lack of compassion. It's that most healthcare systems were never designed with the nervous system in mind. Fear during medical procedures isn't a personal failure. It's a predictable biological response. And when we ignore that, we unintentionally make care harder for everyone involved. That's why, in this video, I want to talk about why needle phobia is still so often overlooked and what actually helps. I work in pediatric phlebotomy, adult phlebotomy, elderly phlebotomy, and I also have a background in behavioral support. That means I spend a lot of time at the intersection of medical care and the nervous system. What I've seen again and again is that needle phobia isn't rare, dramatic, exaggerated. It's predictable, and it follows patterns. Based on clinical experience, observation, and published research, there are reasons needle phobia continues to be overlooked, especially in phlebotomy and outpatient care. I want to walk through them briefly and talk about what we could do to shift. Normalization of distress, crying, freezing, or resisting has become so common that it's often treated as unavoidable instead of information. Misunderstanding fear. Another reason is needle fear is often mislabeled as noncompliance, defiance, or avoidance. But fear responses like freezing, shutting down, or refusing, they're not choices. They're nervous system reactions. We also tend to assume that reassurance alone should fix their fear. But once the nervous system is activated, logic and reassurance, they go out the window. They don't land the same way. Long-term impact is underestimated. The effects of these experiences. Many adults with severe medical anxiety trace it back to childhood procedures where fear wasn't acknowledged. Finally, needle phobia often sits in a gray area. It's not always treated as a medical issue and not always as a psychological one, so responsibility gets diffused. Addressing needle phobia doesn't mean every visit is perfect or pain-free. It means shifting toward comfort care first. Honest preparation, predictability, choice where possible, slowing down when needed, and respecting nervous system limits. These strategies don't delay care. They often make procedures more successful, and they reduce repeat trauma. I recently explored this deeply in an article I published in Critical Values, where I discuss how phlebotomy and healthcare systems can better integrate these principles. But this isn't just for professionals. Parents, patients, caregivers, they deserve this information too. Needle phobia isn't rare. It isn't a weakness, and it isn't something somebody just outgrows. When we understand fear instead of dismissing it, medical care becomes safer for children and the adults they become. That's the heart of Comfort First Care. If this topic matters to you, whether as a parent, a patient, or a provider, you're not alone. Poke Pals believes no one should feel unseen during medical care.